What if the position you sleep in every single night, the one that feels the most natural, the most comfortable, the one you've had since you were 40 years old, is quietly putting pressure on your heart while you sleep? Not while you're lifting weights, not while you're climbing stairs, while you sleep. While your body is supposed to be recovering, that's the question I want you to sit with for the next few minutes, because what I'm about to explain to you is something most people over 60 have never been told. Not by their primary care doctor, not in any pamphlet they've been handed at a clinic. In 70s come through my office reporting the same constellation of symptoms: waking up breathless in the middle of the night, legs swollen by morning, a vague heaviness in the chest that disappears after they're up and moving for an hour. And when I dig into their history, one detail keeps appearing that no one had ever flagged before: the way they sleep. Let me be honest with you about something. The hours between 10 at night and 6 in the morning are not neutral hours for your cardiovascular system. They are not hours of pure rest. They are hours of active physiological work, hours when your heart, your blood vessels, and your lungs are doing something very specific depending on how your body is positioned. And after 60, your heart no longer has the same margin of error it had at 35. The same mechanical pressure that a younger heart absorbs and compensates for without a single symptom can, in a heart that has been beating for 6 or 7 decades, trigger consequences that build silently until they're impossible to ignore. In the next few minutes, I'm going to walk you through exactly what happens inside your chest when you sleep on your right side. I'll explain what it does to your heart's position in the thorax, what it does to your blood flow, what it does to the right ventricle, a structure most people know almost nothing about, but that plays a critical role in cardiovascular health after 60. I'll tell you why this matters more as you age. And I'll end with the position that protects your heart, with the science behind it, and a change you can make tonight. Not next week, tonight. So let's start where the consequences start. Not in the arteries, not in the lab result, but in the symptoms your body is already sending you at night. What your body feels during the night and keeps ignoring. I ask every patient who comes to me with nighttime symptoms the same 2 questions. The first is, how do you sleep? And the second is, where do you sleep? Meaning, which side do you spend most of the night on? You would be surprised how rarely anyone has ever asked them that before. Here's what I hear most often. I wake up at 2 or 3 in the morning, and my heart is racing a little, but by the time I check the clock, it's past. Or my ankles look puffy when I first get out of bed, but it goes away after I walk around for a while. Or the one that concerns me most, I sometimes feel short of breath when I first lie down. So I prop myself up on 2 pillows. Most people over 60 have filed at least one of these experiences under the category of getting older. They assume it's normal. They assume it's expected. They do not assume it has anything to do with which side they face when they fall asleep. But here's what's actually happening. When you lie on your right side for several hours, gravity shifts the position of your heart inside the chest cavity. The heart is not fixed in place like a rock embedded in concrete. It's suspended in a fluid-filled sac called the pericardium, and it responds to the orientation of your body. When you turn right, the heart rotates and shifts slightly toward the right side of the chest. That shift changes the angle at which blood fills the chambers, it changes the pressure dynamics inside the pericardium, and it changes the electrical axis of the heart, the pathway along which your heart's electrical signal travels to produce each beat. Think of it this way. Imagine a pump, an old-fashioned water pump that was built and calibrated to work at a specific angle. It runs smoothly, efficiently for years because everything is aligned the way it was designed to be. Now tilt that pump 15 degrees to the right and leave it running for 7 hours straight every night. The mechanism still works, but it works harder. It strains against an angle it wasn't built for. Over time, the parts that bear the extra load begin to wear. That's what's happening in your chest while you think you're resting. Now, I want to stay with this point for a moment because the symptom most people dismiss as the most minor is actually the first signal worth taking seriously. Palpitations during the night, the brief racing feeling. A 2021 study published in the Journal of the American College of Cardiology, following over 14,000 patients with documented arrhythmia, found that body position during sleep was one of the most underreported triggers of nocturnal palpitation events. And that right lateral sleep position was disproportionately represented among patients who reported nighttime rhythm disturbances, for any of them. If you have ever woken up with your heart beating faster than usual and then gone back to sleep without thinking much of it, pay attention to that. That was your heart telling you something. The problem is that by morning, the feeling is gone and the conversation with your doctor never happens. One concrete thing you can start doing immediately: keep a simple notebook on your nightstand. Not an app, a notebook, because opening a phone at 2 in the morning disrupts your sleep further. Write down the time, what you felt, and what side you were on when you woke up. 3 nights of that information is more useful just in a cardiology appointment than a year of unanswered questions. But the nocturnal symptoms, the palpitations, the slight breathlessness are only the surface of what I want to explain to you, because what's driving those symptoms is a mechanical process happening inside your chest that I think you deserve to understand clearly. And that process begins the moment your body commits to the right side. What happens to your heart when you turn right? When I talk about this with patients who have no medical background, I watch their faces change at a very specific moment. It's not when I mention the statistics, it's when they understand the geometry. Because once you understand what the right lateral position does to the physical architecture of your chest, you can never again think of it as neutral. Here's what's true about your heart that most people don't realize: it doesn't sit in the middle of your chest. It sits slightly to the left, tilted, with the apex pointing down and to the left, and the base oriented up and toward the right. That positioning is not arbitrary. It's the result of a developmental design that makes the left ventricle, the heart's main pumping chamber, do its work most efficiently from that angle. When you lie on your right side, you are essentially pulling the heart away from its functional axis. The apex, that lower tip of the heart, swings toward the right. The left ventricle, which normally is now working from an awkward angle. Simultaneously, the right side of the heart, the right atrium and right ventricle, is being compressed by the weight of the left side. Think of it the way you'd think of a garden hose with someone's foot pressing down on part of it. The water still moves, but it moves with more resistance, more pressure, more effort for the same output. For someone who is 30 years old with a healthy heart, this compensation happens automatically and silently. For someone who is 65, especially someone who has any degree of left ventricular hypertrophy, meaning the muscle wall of the heart has thickened, which happens in roughly 36% of adults over 60 with hypertension, according to data from the Framingham Heart Study, that compensation is measurably harder. The heart is working against an unfavorable geometry, and the muscle doing that work is already less elastic than it was 20 years ago. A retired teacher named Margaret, 68 years old, came to see me 2 years ago. She'd had well-controlled hypertension for about a decade. Medicated, monitored, numbers generally fine. But she'd started waking up feeling what she described as a heaviness in her chest that resolved within 20 minutes of being upright. Her cardiogram during the day was unremarkable. It wasn't until I asked her about sleep position, and she mentioned she always slept on her right side because of a shoulder injury on the left, that the picture clicked into place. We recommended a positional change supported by a body pillow, and within 3 weeks, the morning heaviness was gone. Completely. No medication change, no new diagnosis, just geometry. That's the power of understanding what your body is doing while you sleep. And we are not done. Because the effect I just described, the rotational stress on the left ventricle, is only half of the cardiovascular story. The other half involves a structure you've probably heard less about, and it carries a consequence that I find genuinely underappreciated in preventive cardiology. Before I get to that, I want to pause for just a moment, because what you've heard so far, the nocturnal symptoms, the mechanical stress on the heart from positional shift, is exactly the kind of thing that makes patients ask me, okay, but is there anything I can actually do about this beyond just flipping to the other side? And there is. Many of my patients who are working to protect their cardiovascular health during sleep ask me about the full picture of what happens in those hours before bed and during the night. And I've found that understanding those 2 hours before you lie down is just as important as the position you're in once you do. There's a structured approach to the pre-sleep window: what you eat, the temperature of your room, the specific sequence of actions that shift your nervous system from alert to restorative. That makes a measurable difference in how hard your heart works during the night. If you want to explore that in depth, I've put a link in the description below and in the pinned comment. There's also a QR code on the screen right now that you can scan. It covers that entire pre-sleep cardiovascular window in detail. Bedroom temperature, what to eat and avoid in the evening. If sleep is something you're taking seriously, and after what you've just heard, I hope it is, take a look at it. Now let's keep going, because what comes next is where the risk becomes specific. The right ventricle, the chamber nobody talks about. When people think about heart disease, they almost always think about the left side of the heart. The left ventricle, the aorta, the coronary arteries. That's the side that gets the most attention in popular health content, and for understandable reasons, it's the side most directly associated with heart attacks. But in clinical cardiology, I pay enormous attention to the right ventricle. And it is the right ventricle that takes a disproportionate hit from right lateral sleep positioning. Here's why. The right ventricle is responsible for pumping blood through the lungs. It takes the blood returning from your body, depleted of oxygen, and pushes it through the pulmonary circulation so it can pick up fresh oxygen before going back to the left side of the heart. The right ventricle is thinner walled than the left because it normally operates under lower pressure. It is a high volume, low pressure pump, and it is exquisitely sensitive to anything that increases the resistance. The right ventricle has to push harder against it, and its thin wall is not designed for that kind of sustained effort. When you sleep on your right side, the weight of the rest of the heart and the mechanical shift I described earlier increases the pressure dynamics on the right side of the cardiac structure. At the same time, the venous return from your lower body, the blood traveling back up through the veins toward the heart, is partially impeded by the positional compression. Think of it like a return pipe in a plumbing system that gets slightly kinked. The fluid still moves, but it pools a little where the kink is. In your body, that pooling shows up as leg swelling by morning. The European Heart Journal published findings from a study in 2019, examining sleep position in patients with established right heart dysfunction. Patients who habitually slept on their right side showed significantly higher nocturnal right ventricular pressures compared to those who slept on their left, and those elevated pressures were associated with measurably worse functional capacity the following day, not the following year, the following morning. This is the part of the conversation that I think deserves to land with weight. Your right ventricle is doing extra work right now. But tonight, if you go to sleep in the position you've always used, and if you have any degree of pulmonary hypertension, which affects an estimated 1% of the global population, and up to 10% of adults over 6'5" with pre-existing cardiac conditions, according to the World Health Organization, it's being recorded in your heart tissue night after night. The actionable step here is specific. If your ankles are consistently swollen in the morning, and I mean consistently, not occasionally, bring it up at your next appointment and ask specifically whether right ventricular function has been assessed. Many routine echoes don't evaluate right-sided pressures unless the ordering physician specifically requests it. Ask for it. That's a sentence that could change the direction of your care. Why this matters more and differently after 60. Let me tell you what I tell every patient who sits in my office in their 6th or 7th decade and asks me why the things that never bothered them before are starting to bother them now. I tell them, the rules changed, not because your body is broken, but because the margin for compensation has narrowed. At 35, your heart is elastic. When you put it under unfavorable mechanical conditions for 7 hours, it adapts. It compensates. It doesn't tell you about it because it doesn't need to. At 65, the heart muscle has accumulated decades of strain. The collagen content of the myocardium, the connective tissue that gives the heart its structure, increases with age, making the wall stiffer. The natural pacemaker cells, the specialized cells that generate the electrical signal for each heartbeat, decrease in number with age, are narrower on average than they were 30 years ago, even in the absence of clinical coronary artery disease. What this means physiologically is that the same mechanical stress that a younger heart absorbs without a trace can, in the heart of a 68 or 72-year-old, tip into arrhythmia. It can push blood pressure up during sleep. And nocturnal hypertension, where your blood pressure rises instead of dipping during the night, is associated with a 20% higher risk of major cardiovascular events compared to daytime hypertension alone, according to a meta-analysis of 17 prospective studies published in Hypertension in 2020. That's not a small number. That's a substantial risk happening while you are asleep and unaware. A 71-year-old retired engineer named Daniel came to see me after his wife noticed he was breathing irregularly during sleep. He had no diagnosed sleep apnea. His daytime blood pressure was 128/78, essentially normal. But a 24-hour ambulatory blood pressure monitor showed nocturnal readings consistently above 145/90. He slept on his right side, had done it for 30 years. He told me it had never caused him any problems. And I told him, the problem isn't that it's new. The problem is that your heart's ability to absorb it silently has diminished, and what it used to file under tolerable, it has now crossed a threshold. That's the honest clinical picture. The threshold moves. What was once irrelevant, the slow accumulation of cardiovascular strain that finds its expression years later. The concrete recommendation here is paired with the positional change I'll describe next. But in the meantime, if you have a home blood pressure cuff, and if you don't, I recommend getting one, take your reading not just in the morning, but once in a while at night before bed, and first thing upon waking before you stand up. Compare them. A significant spike in the morning reading compared to bedtime can be an indirect signal of nocturnal pressure dysregulation. It's not diagnostic on its own, but it's worth tracking and bringing to your physician. The right position and what it actively protects. Everything I've told you so far builds toward this. The left lateral position, sleeping on your left side, is not just the absence of the problems I've described. It is actively favorable for your cardiovascular system in ways that I want to make concrete. Because I don't want you to simply avoid the right side. I want you to understand why the left side works. When you lie on your left side, the heart returns to closer proximity to its natural functional axis. The left ventricle, rather than being pulled away from its mechanical advantage. The right side of the heart, which, as I explained, bears disproportionate load in right lateral sleep, is now in a position. And perhaps most importantly for the cardiovascular system, the descending aorta, the largest artery in the body, runs along the left side of the spine. When you sleep on your left side, gravity gently assists aortic flow rather than working against it. There's also a lymphatic advantage that's less about the heart and more about the body's overall overnight recovery. The thoracic duct, the body's primary lymphatic vessel, responsible for clearing metabolic waste from tissues, runs along the left side of the spine and drains into the left subclavian vein. Left lateral positioning facilitates that drainage. Less metabolic debris means less systemic inflammation, and systemic inflammation is one of the most significant contributors to cardiovascular risk after 60. A landmark study from the University of Rochester, published in the Journal of Neuroscience in 2019, examined how body position during sleep. Left lateral sleep showed the most efficient clearance of metabolic byproducts, including amyloid and tau proteins. That's brain science, not cardiology. But the circulatory principle is the same. Left lateral positioning aligns the body's drainage architecture with gravity rather than against it. Now, I hear the objection before you say it. I understand that. Body position during sleep is not fully conscious. But research on positional therapy shows that with the right structural support, specifically a firm pillow placed behind the lower back, which acts as a gentle mechanical stop that discourages rollover, people maintain their starting position significantly more consistently than they do without it. You don't need a specialized product. A firm rolled blanket works. The goal is to create a physical barrier that makes the rollback to the right slightly resistant, not impossible, just enough to interrupt the unconscious shift. Start tonight. Lie down on your left side. Place a firm pillow behind your lower back. Let your right knee bend slightly over your left. That position reduces rotational torque on the lumbar spine while keeping your cardiovascular alignment favorable. That's it. That's a change your heart will register in days. Closing. So let's bring this together because you've been given a lot of information, and I want to make sure you leave with clarity, not just detail. We covered 5 things. We talked about the nighttime symptoms, the palpitations, the morning swelling, the breathlessness when you first lie down, that your body has been trying to tell you about and that most people over 60 have quietly filed away as normal aging. We talked about what happens to the physical positioning of your heart when you shift to the right side, the rotational stress on the left ventricle, the change in electrical axis, the strain on a muscle already thickened by years of working harder. We talked about the right ventricle, the underappreciated chamber that bears the cost of positional compression night after night, often without a single warning symptom until something more serious develops. We talked about why the aging heart loses its margin of silent compensation, why would a 35-year-old without a trace be rhythm and tissue. And we ended with the alternative, the left lateral position, the structural support behind your back, and the cardiovascular logic that makes this a real recommendation. Not a suggestion. You now know something that most people don't know, and that's not a small thing. Most adults over 60 have never been asked about their sleep position by a cardiologist. They've never been told that the geometry of how they spend the night has cardiovascular implications that compound over time. You've been told, and that means you have a decision to make. Not tomorrow, not after you talk to someone about it. Tonight. I want to add one more thing before I close. Throughout this video, I've talked about what happens in the hours your heart is working without your supervision. The position you sleep in is one piece of that, but the 2 hours before you lie down matter enormously as well. The temperature of your room, what you eat in the evening, the state of your nervous system when your head hits the pillow. I've pointed some of my patients toward a structured protocol that covers exactly that pre-sleep window, and the response has been meaningful. If you want to go beyond the positional change and give your heart genuine conditions to recover at night, the link is still in the description and in the pinned comment. The QR code is on the screen now. It covers the nighttime cardiovascular risk window, bedroom temperature, evening nutrition, and a 7-step bedtime ritual designed around heart protection. Nothing does, but because the right information at the right time changes what questions you bring to that conversation. Share this video with someone in your life who is over 60. A sibling, a neighbor, a parent, a friend who mentions that they don't sleep well. You may be giving them information that changes something real for them, and they'll never know where it started. That's worth something. In the next video, we're going to talk about something that affects almost everyone in their 60s who is on blood pressure medication, a common daily timing mistake that turns a protective drug into a source of nighttime cardiovascular strain. It's something your pharmacist has probably never mentioned. I'll see you there.